Well, fall is in the air. It is absolutely delightful outside. If you've not been out there, just check it out. It'll be wonderful for the next some period of time. Of course, we're thinking about all of our friends, relatives, and even though we don't know a soul, in Carolina, of course, Asheville and up in there, that's terrible. Now, Florida is about to get really, really pounded with Hurricane Milton. Is that his name? Yeah, Hurricane Milton, and it's bad. It's a 5, and it's going between a 4 and a 5, and it's going to slam the whole peninsula, and that is so sad. We think about them, but we're having some good days around here. As a matter of fact, I got to go to the state fair this weekend, and I found a deal for you. All right, everybody like a deal, right? This is so stupid that I would find a deal on food. It's a food deal. I love Malone's taffy, and I don't know where you get it any other time, but instead of buying a whole pound of it, you can buy a small bag. It's like half a pound for $8. I think, yeah, that's for me. I'll take that, because otherwise I eat too much of this stuff. And it's wonderful. But a lot of different food places. Turkey legs are like $17 now. I think the last time I went to the fair was 2 years ago. Not $17 for a turkey leg, but it's supposed to be so full of nutrients. The best hamburger, and really the only one I found as far as hamburger, was A&W. They make a good burger. I do like that. Did not see a Sbarro pizza, but anyway, but it was good. And clean. It was so pristine clean. Nice new red trash cans around there and everything. Really very nice. The petting zoo is, of course, wonderful, as it always is. So did you go?
No, I wanted to let you know, though, that 4211 Henderson Road, Byron, Mississippi, is where Malone's Taffy is.
Oh, did they have like a store or something?
They do.
Really?
Online, I'd go to online just to check for everything. But yeah, I've done that research before, and I wanted to say, yeah, it's in Byram.
I don't think I need
Malone's.
to know that, because I just think of them as the state fair. I don't want to know that it's there waiting for me all the time. But anyway, fair is good, folks. Go if you get a chance to. We've got today a couple of serious topics for you. We have 2 doctors in-house. We have Dr. Katherine Pannel. She is a psychiatrist and a doctor of osteopathy. She's an osteopath. She's from Oxford, spends a lot of time down in the Jackson area, and been a lot of times on SuperTalk, so you'll know her. And then we have Dr. Justin Turner. He is the Chief Medical Officer for the Department of Health, and he is an internist, so he deals with a lot of things. We're talking about really the 2 big topics today, and you'll get into them together as well, and other things as we go along. We want to talk about bipolarism and vaping. I want to start with bipolarism, just because it's kind of complex, I think. Somebody says, well, I'm bipolar. Well, this, by the way, bipolarism is what it is now. It used to be called manic depressive. And so who doesn't have ups and downs in life? Whether you're a child or an adult, you have ups and downs. But, Dr. Pannel, you have to know what exactly is going on in the brain that makes it now called bipolarism. What is it that makes it? What is it that makes it where you have to get help? How do you know that as a parent or as a spouse? You can be diagnosed, I think, at any age. Is that correct?
Yeah, sure. I mean, you can even be as in your teens and early childhood and be diagnosed with bipolar. It's uncommon, but it is possible. And it was a great question, just knowing when to seek help. Bipolar, for what it's worth, it makes it kind of obvious when people do need help, especially with bipolar 1, which is the more severe type. When you have a manic episode, it is pretty obvious that they need medical attention. Just the very elevated mood, risky behaviors, dangerous behavior. Sometimes they can hallucinate, get psychotic. That's pretty obvious to go to the hospital. But then there's also periods of severe depression with bipolar disorder. So, just watching your loved one, your friend, if you see a shift in personality, or that they're isolating more, not taking care of their hygiene, preoccupied with death, or if they make statements about wishing that they were no longer here, that's when it's time to seek help, intervention.
You said sort of unusual as a teenager. What about, you usually have diagnoses when somebody's older? Or real young?
So it is more common to be diagnosed with bipolar disorder in early adulthood. But, you can be diagnosed with bipolar disorder as a child or a teenager.
Wonder what's going on in the brain that it has to develop, apparently, for some people to get to the point where they need help. So what exactly is a chemical disorder? What is it?
Yeah, bipolar is a chemical disorder, and that's important to emphasize, too, because there's a lot of misconceptions about mental illness, but it is like any other medical illness. It is a chemical disorder in the brain, and therefore you need treatment for it, and there should be no stigma surrounding it. If you need help, go seek help.
Yeah. What if you're just like borderline? Do you medicate that or what?
So I'm not big on pushing medications. I think that if you do everything that you can, put into place coping skills, get into therapy, and try those things. But if you do those things and it doesn't work and you still need further treatment, absolutely medications are there. So that the gold standard of treatment for all psychiatric disorders is medication and therapy.
What are the medications?
Well, so with bipolar, it's typically a mood stabilizer. You do have depressive episodes, but you don't want to treat those until the mood is stable, because some medications that treat depression can throw you into a manic episode. So typically with bipolar disorder, you want to start with the mood stabilizer to get the mood even. And then if you start seeing that it dips lower and you have those depressive episodes, you can add an antidepressant, and it will not flip them into a mania.
Wow.
Very complicated.
It is. It is very complicated, and the parent or caregiver has to really watch that closely.
That's right. But in saying that, it is complicated, but I want to emphasize, too, that it is very treatable. You can manage bipolar disorder. You're not going to cure it, but you can be symptom-free as long as you're medication compliant. It is a treatable disorder.
I've got to ask Dr. Turner, since you're the chief medical officer at the health department, do we have a high incident rate of bipolarism in Mississippi, or do we have other things in terms of mental, or do you keep track of things like that?
Yeah, that would be more so our Department of Mental Health as far as the actual numbers. We do know that we do have higher incidence of bipolar and other behavioral health related conditions in Mississippi, disproportionately impacting our communities compared to other states. But an actual number, I can't give you an actual number.
Does bipolarism have anything to do with what you eat?
No. What you eat's not going to trigger.
It's not going to trigger.
No, but healthy body, healthy brain. Overall healthy.
Yeah.
I mean,
the brain. We were talking about that a little bit early before, because we use so little of the brain. Do we 30% or something of our brain? Like, what's going on up in there all this time? There's room for all sorts of things, and I hope one day we can get to 50%. Something like that. I need to give the audience ways to get a hold of us today. We're at 888-808-8637 if you'd like to call in. If you would like to text, please pull over if you're in your car, of course, 601-879-4395. And don't forget, we live stream, so you can work, whatever, get your computer to go to supertalk.fm/Mary. And you can see us right here in living color, because it's nicely, we got a good-looking set and everything like that. You think you're looking at a newsroom. So that's how you can get a hold of us today. I was looking to see if anybody has started in yet. So when you manage somebody on bipolarism, how do you treat that person? If it's your child or your spouse, how do you treat them? Do you say, take your meds and go on with life? Or do you say, you've got to watch out for things? Or somewhere in between?
I think it's a combination. Again, I think it's important that they get into therapy, work on their coping skills, work on insight and acknowledging, I do have a mental illness, but it's treatable, learning to live with it, but also medication compliance for bipolar disorder is of utmost importance. It is really difficult to manage bipolar symptoms without medications.
Are there certain things that a person with bipolarism should not do, whether it's school, work, whatever, or certain things that they should do?
Sleep hygiene is huge with bipolar illness. Lack of sleep can trigger a manic episode. Sleep is actually probably the most important thing with all mental illness. Lack of sleep can increase suicide risk, increase depression risk, severity of depression. Sleep is so important for everything mental health. So lack of sleep can trigger bipolar disorder. And of course, you don't want to introduce substances such as alcohol, drugs, because that'll just exacerbate symptoms, cause psychosis, even can trigger suicidal ideation. So,
wow. Certain working atmospheres to avoid or to get into. Are there things that?
I feel like with bipolar, if you're medication compliant and symptom controlled, you can do and work in whatever you want to do. You just do have to make sure that you're protecting yourself. Self-care, high stress can trigger mania and can trigger depression. It can trigger a lot of things, as far as burnout. So that's just something for the general population. Not just with people with bipolar disorder. You want to manage stress levels.
Well, good luck with that.
I know, right? Yeah.
I love it when the doctors will say, well, no, just don't suffer stress and your heart will be fine. Oh,
Do as I say, not as I
whiz.
do, right? Yeah.
Yeah, it makes a lot of sense. And they're both laughing, folks, because they know, it's easily said, but not so easily done. So I want to ask you, Dr. Turner, about vaping generally, but vaping, especially for the bipolar, because you just heard Dr. Pannel say, you don't want to get into the psychotic drugs. Okay, so what about vaping? And if you have bipolarism, even if you don't, vaping in general, I mean, I think it's just nothing more than cigarette smoking, but under a different name other than whatever. But what is it, and how can it hurt you physically and mentally?
Yeah, good morning. That's a very good question. So vaping has become quite popular, very trendy, especially amongst our younger generation. However, vaping is not harmless. So while smoking, we know, is a major contributing factor to disease. Matter of fact, in Mississippi, smoking is responsible for over 5,000 deaths. And nicotine itself is the most preventable contributing factor. So with that being said, there are some people who have looked at vaping as an alternative to smoking, thinking that it's safer.
Right.
Now, while smoking, may be responsible for over 7,000 chemicals when you smoke, e-cigarettes is less likely to have that many chemicals. However, that doesn't mean that it's unsafe.
Does it have nicotine in it?
Yes, it has nicotine in it.
What?
So with smoking cigarettes, those cigarettes are being burned. But when someone utilizes e-cigarettes, you have heated particles that still release nicotine. So nicotine is still there, which is a very, very addictive substance. Matter of fact, it's the gateway drug to the heavier drugs, whether that's heroin, whether that's marijuana, whether that's opioids, which is fentanyl, which is causing a major problem right now. So you have other chemicals in the e-cigarettes, such as metals, nickel, lead, and lead is very important because people are still having maturation of their brain up until age 25. So if we have this trend where we have more youth that are utilizing e-cigarettes, they hadn't even fully had brain development before 25.
And once they quit vaping, it's finished. I mean, does the brain regenerate itself, or are you just stuck?
Yeah, it depends on how long they smoke and also the severity or the amount that they've been smoking. So there are some conditions that are reversible, but there are some patients who develop lung scarring that could be more permanent. Some e-cigarettes develop something called popcorn lung. And
what does that mean? They're little things, I don't know what you call fistulas or something.
So there's lung alterations that minimize the ability to get total oxygen consumption. But there's also a more deadly condition called EVALI, or e-cigarette vaping associated lung injury. So back in 2020, we had over 60 people that died from this, and it's more common, or people are more at risk if they're less than 35. So this is something that's preventable that people think is harmless, but it's not. We had studies in Mississippi that showed that 1/3 of our high school students have vaped at least once. And here's the thing that tripped me out. Even in middle school, we had about 16% in middle school have tried vaping at least once. And I got a daughter that's 15, so that just freaks me out.
Well, yeah, really. And that's very scary. And you've got kids too, Dr. Pannel.
Yeah, I mean, they get pretty creative getting them into the schools too. I mean, there's like clothing that you can buy now to specifically hide vapes.
Pockets or something like that.
And then they have vaping that look like highlighters. They have vaping that look like USB drives. I mean, the people who are marketing to our youth, they know what they're doing.
And that is a very good point. It's because the vaping industry is targeting our youth. I mean, there's no question with the flavorings they put in it. It's so appealing to our children.
Well, yeah, they didn't get anywhere with cigarettes, so now they're going into vaping. Is that sort of that's the new business, right? If you were plugging cigarettes, forget about it. We'll vape.
Yeah, but what's dangerous is the fact that some of them in the cartridges are being laced with marijuana, being laced with THC, being laced with fentanyl, which is very, very potent, very, very deadly. And you don't even have to smoke it. I mean, just having the infiltration through the skin. Matter of fact, according to the CDC, over 80% of the calls to the poison centers nationwide are from children under the age of 5.
And I've heard of police officers who've touched somebody who was having fentanyl, and it gets into the skin.
It's
Touch
so
that
potent.
person, and it'll get to you, and that's really disgusting. I mean, That fentanyl is just, that just blows my mind that people would out and outright take the pills. What, are you dumb? It kills you. I don't understand. See, this is a good psychiatric question, I guess. That it kills. I mean, everybody knows that. So why do you say to yourself, well, maybe I can take it, it won't kill me? Is that what people are saying? Is that when you've treated people with
Well,
it?
and this is the fentanyl crisis is really hitting our young adult population too, who, again, like Dr. Turner said, their brains aren't fully mature, so we're a little impulsive, and they're taking what they think is safe. Like, they're taking what they think is just an Adderall. They're going to take an Adderall, stay up and study late, and they don't know where it's coming from, and it's being laced with fentanyl, and they end up dying. But that's why it's so important to emphasize that unless you pick up your medication from a pharmacy directly, no pill should be considered safe.
Yeah, why would you pick up drugs from people on the street?
Well, you've got that whole mentality too of like, it's horrible. I know it's going on, but it's not going to happen to me until it does.
Exactly.
And then another point is nicotine also releases the surge of dopamine. So if any of us are on social media and someone likes one of our posts or picture, it causes a release of dopamine, which activates our pleasure pathway. So it makes us feel good. It makes us feel a sense of belonging. It makes us feel being validated. So, you have youth and even adults who look for that dopamine release when they, smoke cigarettes or utilize the e-cigarettes, and that makes them want to continue to have that feeling. Although they know it can be harmful, the desire for that feeling is greater than the concern or the risk of having any damage.
I think that's very sad. Don't they stop and think, hey, this stuff is killing me or could kill me or something? You have to stop and think about that. I would think.
I think by the time you get to that point, you are unfortunately so addicted that it becomes a real difficulty to get off.
And how do you get off of vaping? Is it just like, well, I was telling you, when I quit smoking, I just threw it away and that's the end of that. I'm not going to go through hell, because you don't have to if you don't want to. But is vaping the same thing as if you're going to quit vaping? Is the same thing like quitting cigarette smoking, I guess, right?
Yeah, sometimes it's that simple, but sometimes it's not. Fortunately, the Mississippi State Department of Health, we have our Office of Tobacco Coalition that has support all across the state. We have 34 tobacco-free coalitions that covers all 82 counties where we have free support. We've had funding from the Mississippi legislature and other entities to have what we call an ACT Center, where people can get tobacco cessation programs for free to learn how to quit. Sometimes you need additional medications to help you quit. So there's tons of resources that are out there that we're thankful to have for anyone who wants to quit.
We'll talk more about that with our two doctors here on Mary Wieden and You. We're going to take a break and be back in just a few minutes. Stay where you are. Mary Wieden and You, two doctors. Dr. Katherine Pannel, she's a DO, doctor of osteopathy, and she's also a psychiatrist, lives in Oxford, comes down here a lot. And Dr. Justin Turner, he is the chief medical officer at the State Department of Health, and he's an internist. You're the doctor that we go and see for diabetic purposes, right? And,
yes, ma'am.
This is another thing about diabetes. You can actually get cured from it, can't you, if type 2?
What we typically say is it can be controlled and managed, and you may not require medications to keep your numbers where they need to be. So a common line that I like to give when I go out and speak and talk to patients, you can have diabetes, but diabetes doesn't have to have you. And I say that because diabetes significantly increases the risk of cardiovascular disease, which is the number one cause of death in Mississippi.
And would you say the number one cause of diabetes type 2 in people is obesity? That seems to be the big trigger, right? So
it's usually multifactorial, but we would say environmental as opposed to genetic as far as type 1.
Right.
So obesity is a big factor. Our nutrition or lack thereof is a big factor. And the inability for us to exercise is a big factor. So all three of those contribute towards a lot of the environmental contributions towards why we have so much diabetes.
There was a couple who used to live in my subdivision, and they both got diagnosed, and they were overweight, fairly grossly overweight. And both type 2, but they went on these diets, and they both got off of metformin or whatever it was they were taking, and they were so proud of themselves. And I thought, well, that's really very cool.
Yeah, we see it a lot, but we also don't want to, give patients who are small a false sense of security, thinking that just because they're smaller that they are, unlikely to get diabetes, because our nutrition habits in Mississippi leave a lot to be desired.
Gotcha. Too much fried chicken.
Speaking of the fair, right?
Yes. Speaking of the fair. Yes, well, I mean, after all, I did have hamburgers to go along with my taffy.
Hey, that was a cheap meal for the week.
That was it. I mean, It's pretty good. Well, so about the small people who can get type 2, really. Type 1, this is a whole other thing. Type 1 is something you live with for the rest of your life. And it can be diagnosed, can be any age, I think, right? Any age can be diagnosed.
Yeah, usually younger at birth, but you can find out that you have it, at older states.
Later on.
Yeah.
And they wear, pumps and things like that are really very helpful. The type 2 people, I don't necessarily, they're mostly on pills, right? And they don't get pumps.
Yeah, type 1 diabetes, you have to have insulin because your body doesn't make it. And typically with type 2, you have insulin resistance, so your body doesn't utilize insulin that your pancreas naturally makes. But as far as insulin pumps, we normally see that in type 1 diabetes. But if someone is type 2 and they're very uncontrolled, it's possible that they may need a pump as well for control. Now,
mainly just it's what they're eating. It's bad stuff, right? They just don't want to.
Nutrition is a big factor. Now, we have seen a lot of advancements with therapeutics. So the newer class of medications, which I'm sure you've heard about as far as Ozempic and
that's a great weight loss pill, right?
Yeah, so it's actually helping a lot of patients actually come off insulin, and a lot of patients having better control. So I hadn't seen as much patients needing to be on pumps, since the emergence of those classes of medications.
Mm-hmm. Well, maybe they like the weight loss. I don't know. I don't really know. But so we still lead the country, though, probably in cases of diabetes, don't we? Incidents of it. Do we?
We're not number one, but we're up there.
Yeah, we don't want to be number one, but
I will point out that out of 2.9 million Mississippians, we have approximately 344,000 with diabetes. But here's the thing.
Do the math. That's
over 800,000 with prediabetes. So when you add up the amount of patients with diabetes and prediabetes, that's 1/3 of our population.
That's a lot. That's an awful lot. And from a psychiatric point of view, Dr. Pannel, what do you think about that? Do you treat people who say I have to go? I'm going crazy, even though I'm working with my doctor over here on my diabetes or something like that. What's going on in my head that I can do to stop that?
Well, I mean, like we said earlier, the mind is connected with the body. One affects the other equally. And it goes back to, again, self-care. Like, you want to diet and exercise. You feel better when you're doing those things. So it plays a huge part in the treatment of diabetes, your mental health. Those that are depressed, that sometimes they tend to overeat. They find comfort in food. They try to eat their way to happiness. But that's just an instant gratification. Yes, it feels great to have that burger and taffy in that moment. But long term, it's not sustainable. It's not healthy. So, I mean, diet and exercise, that's an important conversation I have in every one of my visits, outpatient visits, is the question of, are you getting out? Are you exercising? Because we know that exercise increases the dopamine that some get and seek from alcohol or other drugs. You can get that in a good way, a natural way. Go outside, take a walk, jog, and increase dopamine naturally and feel better.
7,000 steps at the fair I took.
See, there you go.
Good job.
I'm a walker, sort of. I mean, I walk my dog.
Be the change you want to see.
Well, yes. I have to take a medication because last year when I had this crazy fallout thing, one of the things I had to do is for my thyroid. Like, thyroid? What is that? What is that all about? And the thyroid pill is putting some weight on me, and I don't like that because it increases your desire for sugarholic. But anyway, so you have to watch out. I have to watch what I eat. So the taffy was a real big deal. But so don't take it from me, everybody, what you should eat. That's for sure.
Everything in moderation, right?
Yes. Yeah, well, that's why I went from
there you go.
a pound to 8 ounces. Yeah. There you go. That's it. And there's wonderful healthy food at the fair, by the way. There's a lot of good healthy stuff. Oh, and the biscuit. I forgot about the biscuit. Got the free biscuit. I forgot about that. Everybody loves to go get the free biscuits, by the way, at the fair.
We do want to encourage patients to eat healthy, but again, there's also a balance in meeting the people where they are.
Yeah.
And I think that we make the mistake sometimes of giving patients the idea that they just need to be healthy, lose weight, eat better, and that they can never have a honey bun for the rest of their life. So as Dr. Pannel mentioned...
Well, they'll kill me, I bet.
Yeah, moderation is important. So if someone feels like they can't eat any of that, then they just give up. But, talk to your primary care doctor and figure out the amount of calories you need to have, the amount of good carbs, bad carbs, and allow yourself to have a cheat meal if you've done good the previous 6 days.
So when we went to break, by the way, we started talking about quitting smoking and quitting vaping. And my question was going to be, and is now, so I got to jump back into that, was it seems like a lot of people are smoking. Has smoking decreased? The number of smokers decreased in let's talk just about our state, or is it still as popular as it ever was?
We have seen the amount of cigarette smokers decline in Mississippi, and we're so thankful for all of our partnerships, our community, and everyone buying in. Over 70% of employers agree for tobacco-free, restaurants. So we have a lot of support. We're thankful for the legislature. We're thankful for University of Mississippi Medical Center. So many people who are helping us with tobacco-free campuses. So there's a lot of buy-in. However, we haven't seen the long-term impacts of e-cigarettes because it's new. The first death that we saw was in 2019. So we'll find out a lot more in due time. But yeah, the decline of cigarette smoking could be augmented by the fact that we have increase in e-cigarettes.
Vaping and e-cigarettes, would you call them like cigarettes light? Because we talk so much about the properties of them. I mean, they have some god awful things in them, don't they? Awful metals, lead, and things like that. But it would what do you call it? Nicotine. But is it lighter than cigarettes? I don't want to encourage anybody to. I don't want anybody to think, oh well, yeah, I guess I can do that. It's not as heavy as a cigarette on me, but it.
I mean, I guess you could say that maybe vapes or cigarette lights, but I just caution any kind of verbiage like that because you keep hearing everywhere that vaping is safer than cigarettes, safer than smoking cigarettes, and I think it leads to misconceptions in our youth that they hear that word safe and safer and they think, oh, okay, so it's safe. I think we just need to say that maybe vaping is less evil, less bad, but it's still bad.
You don't
want to do either.
Exactly, because it's pretty stupid.
Yeah.
Take it from a former smoker. I mean, it's like, I don't care if people smoke around me. That doesn't bother me. I mean, I just go, gee, I'm glad I don't do that anymore. I mean, that's their business.
Yeah, and let me mention e-cigarettes. We hadn't talked about this. E-cigarettes are very dangerous in the pregnant population.
Oh.
And in a state where we have amongst the highest maternal mortality, we have a lot of women who may be smoking or utilizing e-cigarettes that don't even know that they're pregnant.
Oh gosh!
So when you talk about the economic impact of tobacco
and the physical, I mean, what do you do to your children? What do you do with unborn children? What happens when you do these? When you that's what I'm looking for.
Definitely impacts fetal development.
It does, as much as regular cigarettes.
Increase the risk of preterm births, low birth weight, cardiovascular disease. I could go on and on as far as the other things that also leads Mississippi as far as having the highest infant mortality in the nation.
There's a lot of bad stuff out there. I mean, it's terrible. Between, stuff like that and fentanyl, I mean, golly, that's I'll never understand that. I don't understand why people do that. Do we have enough facilities to help people who are in these crises?
No.
Okay, simple one.
No, we don't. And everywhere, everyone is aware of that. The legislature's aware, and steps are being put into place to increase facilities for addiction treatment.
Well, and speaking of addiction treatment, though, people who go there, are they going there because they truly want to get off of whatever it is they're on, or do they go there because they should, or the family puts them in there, or the boss says you better go to treatment, you're in terrible shape? I mean, how many people are there truly to be healed?
There's a mixture. You see both. I mean, you can actually commit someone into addiction treatment, but what I have found in my experience is that unless the person has good insight and is willing to admit that they do have a problem, they are addicted to whatever, that the treatment's not going to be effective. You have to be willing and ready to quit.
Let me mention, so Mississippi State Department of Health, we do have a medication-assisted therapy. That's an outpatient service, and we have patients who are thanking us every day for getting their life back, getting their wife back, getting a relationship with their kids back. So it's an outpatient program for anyone struggling with opioid addiction that we have, and it's expanding, and Dr. Edney is leading the charge, and it's going really, really great. So to Dr. Pannel's point, there are a lot of patients who really are willing, but they may or may not know about resources that's out there. So the health department has a free statewide program that's allow patients who have challenges with opioids to be able to get treatment free and no charge.
Well, we were talking about, not opioids per se, but we were talking about, what is that,
Kratom.
And
that's what you were saying, too, is that there's just so many.
That's at the convenience store. What is that?
That's right. And that's another route in which things are getting snuck into our state, in the country, that are not safe because they're not being vetted by the FDA. And one of them is Kratom, which, I mean, it's
It's
a natural plant from some Asian countries, but it has opioid properties. It works on the exact same receptors as an opioid would, those addictive receptors.
And you can get help for that too, like for that kind of addiction. And anybody can get this, huh? No matter what it is that you're doing. Is medical marijuana, is that helpful to everybody, or what's the deal with medical marijuana? Is it a good thing? I see it as step number one to legalizing for recreational purposes. But I don't know.
I mean, I think that's what's going on in our state in Mississippi. I do think eventually, I think that it eventually will become legalized, unfortunately. But I think there are some extreme conditions that medical marijuana is, effective for.
You would never prescribe it.
Well, so I don't. I mean, in my opinion, that I don't think that the medical marijuana is helpful for psychiatric disorders. But I do think there are medical disorders. I mean, if you have terminal cancer, nobody wants to suffer. I think they should have everything available to them for quality of the rest of their life.
And hold the thought, because we're coming back for our final segment. Time's flying, as it always does on this show. Stay with us. It's Mary Wieden and you. We'll be right back. Well, we got our final segment with the doctors here. I'm telling you, I didn't know how long we were going to go today. It was like, it's typical. We need to steal an extra hour from somebody. Dr. Katherine Pannel, she's an osteopath and a psychiatrist, and Dr. Justin Turner. He is the chief medical officer at the State Department of Health and an internist. And so we were talking about, marijuana was one of the things we were talking about. It's medical here. It's for medical purposes. You can get it, but I think, and so do a lot of people, it's just a precursor for recreational. And that's. And on the one hand, it's kind of scary. On the other hand, it's like, well, if you want to do it, if you want to have it, you'd like to know that it's clean, and you'd like to know what the content of it is. Are you all talking about that at the health department, Dr. Turner, at all? About the day when it might happen?
Well, I'm not sure if we're talking about the day when it might happen, but we're talking about our responsibility from the legislator to stay in this program. So currently, we have a very robust effort where we look to make sure things are safe and we're protecting the public. That's our mission at the health department, to protect, advance, and promote the safety and well-being of every Mississippian.
Well, yes, but, how many people, I was kidding, but, I was saying, oh, gee, my shoulders are sore from doing yard work. I think I need some of that. That's not a reason. You have to have a reason to get it, don't you? You mean you just don't walk in and go, oh, gee, I don't feel good. I stubbed my toe. No.
There are qualifying conditions, and, we go by best practices and evidence. So as evidence, allows us to be able to have conditions that are medically necessary, that's what we, advocate for.
Well, you have to. Well, do you go to a doctor at the dispensary? I don't know. Are there doctors at the dispensaries? I don't know.
Not at the dispensary.
Right.
You would go to see a physician that's certified to give those marijuana certificates. You would go and be evaluated in their clinic, and then you'd pick it up at a dispensary once you have the certificate.
Does it come in different amounts of THC that that the patient picks up, or that you're prescribed? How does that happen? I have no idea. I've never talked to anybody about this on the show, by the way, about medical marijuana, really. So how is it? Okay, I got something wrong with me, I'm going to go get this stuff. Who decides how much my THC content is, and are there different levels of THC available?
Yeah, the physician that does the certifying decides that, and they go to the dispensary and they discuss, all of that. So there's different routes that patients can have it, whether it's through gummies, tablets, transdermal through the skin.
Patches.
Right. So patches, right. So all of that is discussed.
Brownies. No,
yeah, all of that is discussed between the certifying physician or certified prescriber and the dispensary.
Well, how are we doing in Mississippi with that? Are we doing okay? I mean, or, are there abuses, or what's the deal? I just, kind of can't wrap my arms around that one too much.
Typically, when you have something out there that's intended for good, there's ways that people find it to misuse it. But like I said, we have regulatory capacity to be able to make sure that we are meeting the expectation that has been commanded to us by our legislature.
Have you had any instances of dispensaries overdoing it, or doing the wrong stuff? They have to be shut down because they violated the laws of Mississippi regarding this, or do we not have that yet, or what?
Yeah, we've had some incidents of bad players, but again, the rules, regulations we abide by and make sure that anyone who wants to continue to do business in Mississippi, they have to abide by those particular rules.
Okay, that means we've had some cases. I mean, you've had some cases, but that's unfortunately people have to bad people have to ruin stuff for good people, which is really terrible. Well, the thing about like going into rehab, and we were talking about that, the guy from South Carolina, Alex Murdaugh, the man, there was when he was on trial. You know, folks, who I'm talking about, the guy who he had briefcases full of pills. I don't know what the pills were. I have no idea, but briefcases full of this, and then there was as part of the trial, there was discussion about his brother taking him to Atlanta for rehab. And I'm thinking, this is a guy who's going because he has to, but when he's going to come home, he's going to go back to his briefcases. Come on. But unfortunately, these are people, I think, that take advantage of the whole thing. There are people who really need to go to rehab and are sincere about it. But then these people who just, stop in for a while because they have to. That seems like it's not a good thing.
And it does nothing for stigma. It just worsens stigma when people think that there's nefarious reasons for people going into rehab to avoid legal charges or to, stars ruining their reputation. That all that does is stigmatize the treatment that people really need and want, but sometimes they don't get because of the fear of what others will think about them.
Yeah, and a guy like that taking up space at a place, that's a shame.
Absolutely.
That's really sad. But so we do need mental health facilities. Are too many people put in jail who really ought not to be in jail?
That has been a huge issue in Mississippi. Representative Sam Creekmore and Representative Kevin Felsher have really led the way on that. They saw that it was an issue, that we were jailing way too many of our people with mental illness, and they have put legislation in place to really correct that and have done a fabulous job.
Oh, mental illness meaning bipolarism, we talked about that. But what else? What other things?
Schizophrenia. It can sometimes be our severely mental ill that may do something that's due to agitation, but it's because of their mental illness, and they're going to jail to wait for beds to open up.
Oh, not good.
Right.
Not good. And so so it's up to the legislature to decide, look,
it's not necessarily up to them, but they have been great in providing funding for we have the 998 system in place in Mississippi that's been funded by the legislation. You can call 988, you can text 988, you can go on your computer. It's just when you're having a mental health crisis, whether it's substance use, emotional distress, you just call 988, text 988, and you're linked with a counselor who's trained, who can talk you through the crisis. And if they're not able to, they can provide you with resources that are in your area, because it's based off your area code when you call in, of where you can go and get help. And then if you feel like it's to a point where you do need further intervention, we have a mobile crisis unit that can come out and do further evaluation, or they'll take you to where you can get treatment.
So that would apply. Would that apply to family members or caregivers, spouses, whatever?
Anybody
if your spouse
who
is in crisis, and you don't know where to turn to. 988, huh?
Yeah.
Right, so instead of calling 911, you call 988.
I wonder how many people know that.
It's the 911 for mental illness.
Has that been around for a long time?
It has, but the sad thing is still so many people don't know about it.
So folks listening to this program know about it. 988. 988. So that's a good thing to know. And they can,
it's confidential, it's free.
Help you then and help you decide what to do.
That's right.
Because you don't always know what to do.
That's right.
Is that pretty prevalent around the country?
Yeah, it's a nationwide program system, but the resources that you get are local to where you're calling from. So you're not going to call 988 and get a treatment center in Michigan. It is going to be in your area because it is based off of the area code of your phone number.
Yeah.
It's great.
That's pretty good. What do you think about that, Dr. Stern? You like it, huh?
It's been great, and like she said, we're thankful for any support that we get from our state leaders that are helping us fulfill our mission. Mm-hmm. Unfortunately, a lot of people don't know about resources that are out there.
Exactly.
And we started out talking about vaping, and this is something that we hadn't talked about that I think we need to put out there. Vaping has also become a source of transmission of sexually transmitted infections.
How is that?
We have youth that are taking their vaping devices and apparatuses, they're hiding them in the school systems in their private parts, and they are going to the bathroom and quote-unquote rinsing them off and still using them. So we've had cases here in Mississippi where in a classroom they would have 4 or 5 children with oral lesions in their mouth tied to a sexually transmitted infection. So, right now we're top 10 in gonorrhea. We're number 1 in gonorrhea, number 2 in chlamydia, number 6 in syphilis.
Avoidable.
And syphilis is out of control right now. But in contrast to gonorrhea and chlamydia, the sores that usually show up in syphilis are painless. So if you're just spreading a vaping and you don't feel any pain, but you're also not inspecting your mouth or just being careful, you possibly are spreading disease. So we don't want patients to only think about what vaping can do to their lungs and all of that, but realize that you also could be using something and actually catching something at the same time.
I would never have thought to ask that question because I never heard of such a thing. I mean, that's really sick, if you ask me. I
really
think that's sick.
Because, back in the 90s, syphilis was just about eradicated.
Yeah.
And now we got babies who have died here in Mississippi because their mom had untreated syphilis. And that's just unacceptable. So we do have a syphilis task force that Dr. Edney has had us to initiate, and we're working very, very hard statewide to get the syphilis under control. But vaping should not be a way that it's being spread.
Dr. Edney, by the way, is a state health officer, if you don't know who he is. We've had him on the program. I think it's about time to have him back. I had him on. He was in the job maybe just a few months. Well, now he's been at it for a while. But that's okay. That's one of your number one topics to deal with, right?
Yes.
And what about yours, Dr. Pannel? Number one topic in the field of psychiatry?
Oh gosh, there's so many. I do think right now that we, especially with our teens and adolescents, we are in a mental health crisis, a suicide crisis. We're seeing increased numbers in both, maybe tied to social media, cell phone use. So that's something that we're really trying to. I mean, would take another whole segment to talk about, but that's really something that we're trying to get ahead of. With Surgeon General warning, we don't know for sure it's that, but it's sure looking that way. And there's some things that you can put into place now to prevent all of that.
And you know what? The music's going to start up on us because it's going to be time for us to. Oh, just a few seconds here. Thank you both, Dr. Turner and Dr. Pannel. You'll be back. And we'll be back on Friday with John Horn. Stay with us for that one.